Hi, hello, my name is Denisse Bernal. Today I'm going to do an assessment with my husband. The assessment is the HEENT assessment, which is head, eyes, ears, nose, throat, and neck. His name is Leandro. Leandro, will you allow me to record your video and upload it for educational purposes only?
Yes, I allow.
Thank you. Okay, we're gonna start. What I'm gonna do is I'm going to assess your head, your eyes, nose, mouth, throat, and neck, okay? Okay, so what I'm looking in your head is to assess the shape of your skull size and looking for depression, masses. Let me check. I don't feel anything of those. Your hair is healthy, is well spread. I don't feel any mass, any depression. In your face, I'm looking on your facial expressions, facial edema or involuntary movements. Both of your facial expression are symmetrical. I don't see facial edema. Everything looks okay. Now I'm going to move to your eyes. I'm going to assess the eyes. Your eyebrows, the eyelashes, and the eyelid look okay. No swollen, no oily, no obstructions. The hair is well distributed and clean. Your both eyes are symmetrical. Your conjunctiva is open it. Your conjunctiva is pink. The sclera is white. Your iris is completely brown, and your pupils are 3 to 4 millimeters. Now I'm going to assess the. Now I'm going to test for the sensitivity to the light. Okay. Both pupils are constricted as expected, which is normal. So now I'm going to measure your vision field. So what I want to help me to do is put your right hand in your eye and look at my eyes or nose and let me know if you see my fingers moving.
Yes, I see it.
Do you see it?
Yes.
Okay. Now you can go out like that. So now I'm going to ask you to follow the pen. Okay? Now look at my nose, and then I'm going to move the pen through your nose. Perfect. I measure your extraocular movement and convergence, and it's no strabismus of nystagmus. Everything looks perfect. Now I'm going to look on your internal structure of the eyes. Okay? A second. Okay. Okay. This way it could be a little uncomfortable. Okay. I can see the retinal vascularization is perfect, and then no abnormalities in the retina, and the optic disc is normal. Now I'm going to measure your vision acuity. So I want you to cover one eye again with this hand. I'm going to put this card, and then you're gonna let me know if you can read the little line here. What letters are?
L, T, F, P, H.
Okay, that's perfect. That means your vision acuity is perfect. It's 20/20, which is what we wanted. It's expected. Now we already assessed your eyes. We're gonna move to your ears. I'm going to check your ears and your hearing. So I'm going to look for symmetry in the auricles and any masses or discoloration on the skin. Both of your ears are symmetrical. I don't see any swollen or redness or discharge. So now I'm going to look the otoscope to look for the structures inside. Okay, please let me know if you feel any discomfort. I'm going to pull and push back. Okay, or I could see I don't see redness. I don't see swollen or obstructions. I don't see any perforation on the tympanic membrane. The only thing I could see is serum, which is expected. It's okay. Now we're gonna perform hearing test. Those are special tests. We're gonna do it with this tool. Okay, so this tool, the first Weaver test, is going to help me to measure the audition in your 2 ears. So what I want to know is you're gonna let me know if you hear it in the right or the left or in the middle. Okay, so I'm gonna go back. Where do you hear?
In both ears.
In both ears. Okay, perfect. So now I'm going to do the reading test, and this is going to help me to understand compare the audition between the bone and the airflow. Okay.
Okay.
So you're gonna let me know where do you hear more? What position here or the bone?
The bone.
You hear it here or here?
Here.
Okay. It's more on the air. Okay,
yes.
It's expected because the air has more audition than when you place it on the bone. Now I'm going to move to assess your mouth. So what I could see on your lips, the skin is intact, it's no ulcerations, anything. Your color is pink, moist, and let me now move to assess your mouth inside. I'm gonna look for For white patches, I'm going to assess your gums, your denture, your tongue, and the pharynx, and the soft palate, and the back of your tongue, the floor. Okay, open your mouth, please. Okay, close your mouth. Let me assess your... Okay, I could see your gums well. Open the mouth. Now put your tongue out. Okay. Okay, perfect. So your gums are healthy, are not swollen. I don't see any ulcers. I don't see swollen inside, not obstructions. Your back of the floor on your tongue is intact, which is okay. No signs of cancer or lesions. Your dentures are perfect, are intact, so it's okay. Now I'm going to move to assess the throat and the pharynx. So I need you to help me to do the sound ah. Open the mouth and do ah. Okay. What I'm looking here is to assess the uvula, the pharynx, and the tonsils. And what I can see here is like the uvula rings when you say ah, it's completely on the middle, and the tonsils are small as expected. So it's no abnormalities there. Everything looks good. Now I'm going to move to assess your neck. Okay. Do you feel any tenderness?
No.
Stiffness?
No.
Okay. Let me see your range of motion. Any pain or discomfort when I do this?
No.
Okay. So I'm now checking your lymph nodules. Okay, perfect. I can see it. Any nodules swollen, nothing. Your nodules are okay. Your range of motion too. No stiffness in the neck. Now let me check your trachea. It's well positioned in the middle. Your thyroid glands are not enlarged. Okay, perfect. Thank you, Leandro. Now we conclude our assessment of HEENT. Thank you.
Thank you.